Hello. In this video, I'm going to be discussing foam rolling and how we can use foam rolling to relieve musculoskeletal aches and pains, particularly for the back. Wonderful work for the back. Also for reducing post-workout recovery time. And we'll talk a little bit more about that. But first, I just want to talk about what is a foam roller, then I'll talk about how does a foam roller work, and then I'll talk about that name SMR, self-myofascial release, and why we use that name, okay? So first of all, a foam roller. A foam roller, I have some examples here, is typically thought of as the classic standard foam roller. It comes in black and white and a couple of other different colors, but there are many densities as well and length. This is 36 inches. It also comes 18 inches. It's 6-inch diameter, okay? Different densities, so you might want to check it out and see what you're comfortable with. The deeper you want to go would be the higher or greater the density. Then there are these varieties on foam rollers. This is one of my favorites, if not my favorite. I like the knobbies on it. The knobbies allow you to dig into trigger points really deeply and get some additional release there from trigger points. Then there are a number of different types of balls. This is a particularly large one with knobbies on it also for trigger points. And there are smaller ones. You can use lacrosse balls, tennis balls, handballs. But the balls are great because you can get into those hard to reach areas that the foam roller might not be able to get into, okay? And then there are sticks. This is a flexible stick. A stick is a beautiful portable form of SMR, self-myofascial release, and it can be used on sort of easy to reach areas like the thighs, the lower back, maybe even the upper traps. You can't reach as many areas as you can with a foam roller or ball, but it's nice to have, and you can go on the road with this as well and travel with it. It stows away very easily. So foam rollers work essentially not even just on the muscle, but more specifically on the myofascia, which is the coating of the muscle. All right, and the way it works is as we roll over that tissue, it both thins it out, it lengthens it, and it rehydrates it because you're squeezing out the fluid as you roll over it, and then the tissue absorbs fresh fluid like a sponge, and it rehydrates those muscles with new fluid, you might think of it that way, okay? And the reason we call it self-myofascial release is because we're really affecting the myofascia, okay? And myofascia, when it becomes dysfunctional, well, first of all, it's the wrapping around the muscle. It encases the muscle, okay? It's like the sausage wrapping of a muscle. When it becomes dysfunctional, what's happening is it's getting thick, it's getting sticky, and it's getting short. So foam rolling does the exact opposite. It unsticks it, it lengthens it, and it thins it out, as well as rehydrating it. Rehydrating is how it gets it to be unsticky. So it's going to so foam rolling is going to work to increase your range of motion, decrease your pain and inflammation, and decrease post-workout recovery time. So I encourage you strongly to seek out some great foam rolling and myofascial release exercises, and you can find a nice amount of those on the Aligned Life and the Aligned Brooklyn platforms. So check it out. Foam rolling works. Thank you for listening.